morning. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. It's January 8, 2026. This is our second surgical day of the year of 2026. Our patient travels here from New Jersey. He is a pastor. He has pain in his thoracic area in two spots. One is up at T3-4, the other is at T8-9, 9-10. So he has really three herniated discs that are causing debilitating pain for him. The pain is horrific. It keeps him from sleeping. He found out about Deuk Spine Institute's legendary laser disc repair and decided he was going to come here and see if we could help him. We did a Zoom call and I felt we could help him. And here he is. We're getting ready to use the laser to debride and repair these three discs. This is by far the hardest surgery we do, and we all said our prayers before the surgery that it goes well, so I'm hoping and praying everything goes well. Our patient is prone. He is resting. We're going to numb up the skin, and I'm going to place a needle to, it's already done, right? I'm going to place a needle in to access the discs. We have three discs that we need to access with a spinal needle from the left side. Now his herniations are very small. They're bulges, but they're very painful for him. So that's why he's here getting treatment. Nobody wants treatment. Nobody wants to have surgery. We do surgery because it's necessary to alleviate a problem. In his case, the problem is pain. All right, I'm going to go ahead and get focused. There is T1, 2, 3, 4. We're exactly where we need to be. And I'm going to head towards that spine. Let's go ahead and go to a lateral view. 1, 2, 3, 4. Everyone agrees, 3, 4, left approach. If you have questions, feel free to type them up for me during surgery. I'll do my best to answer your questions. In the meantime, we're going to be focusing on getting this needle into position where it needs to be. All right, so I see we've got a disc there. Can you pull up the MRI? That's amazing. That vertebral body just doesn't look normal there. It's very hard to tell, but the MRI, it looks fine. It's interesting. Could be just the rib overbearing. I think it's just the rib coming around. All right, you can see the needle in the back. Let's take another shot. I have to make it from there to the spine. You think that's 3, 4 there, Jordan? You could be right, Jordan. Well, let's see. Shot? We have to figure it out. Let's, I have to choose one of those two in terms of aiming for them. So, shot? Let's go ahead and see where this is. AP? Localization and picking the right levels is very important in spine surgery. Yeah, I think you're right. That's too low. So there's 1, 2. So I think that's 4, 5 I'm aiming for. So we need to go back up to 3, 4. Shot. I think that is 3, 4 there. You're fine. Let me just see what we can do. This is the hardest area in the spine to treat. Shot? All right. It looks like we've got the end plate lined up good. Henry, while we're working on this, why don't you show the audience the different causes of pain in the thoracic spine, if you would?
Of course.
I'm Dr. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk. Thanks for joining us. Welcome back. You can see from our video there are many causes of back pain, that the most common by far is the disc. Discs can be injured through trauma, and when they're injured, they can cause traumatic tears. So 12, 11, 10, 9, 8. You agree, 8, 9? I think it's 8, 9. Perfect. Lateral. No, it's good. Go for a lateral. 12, 11, 10, 9, 8, 8, 9. So we're at the right disc, 8, 9. We're going to do 8, 9, 9, 10, correct?
Yes, sir.
All right, I think I'm not going to take a question yet, Henry, because this is the hardest part. I'm just going to focus on the patient for a moment.
Copy that.
So the questions can wait. In the meantime, if you'd like to show the audience, how do we fix injured discs so that we get rid of the pain using the Deuk laser disc repair treatment?
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The advantages with the Deuk laser disc repair is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back, folks. Welcome back. We have placed our transforaminal needle at 3, 4, 8, 9 successfully, and now we're working on the next disc, which is 9, 10. We're doing 3, 4, 8, 9, 9, 10. Everybody agree? So now, shot. I think I'm a little bit, need to be just a hair lower than I am. Shot. Any questions from the audience? I might be able to take a question or two.
Yes. This question is coming from Kill a Penguin on YouTube.
Oh God, kill a penguin?
Kill a Penguin.
Oh no, that's horrible. Why would you want to kill a penguin? But we'll take kill a penguin's question. But I highly recommend you don't kill a penguin.
Asking, does anything in the buttock besides the piriformis cause leg pain radiating down to the foot?
No, there's nothing else. It's literally the piriformis, or it's the pinched nerve from a stenosis in your spine. So the number one cause of pain radiating down is going to be a pinched nerve in your spine. Let's get an AP. The number 2 cause is the piriformis syndrome. There is no other cause of pain radiating down your leg that I'm aware of. Now there is, of course, hamstring tightness. Like some people have hamstring problems, but I don't know that that's what you have. But a hamstring issue can also mimic sciatica. So if you have a ischial tuberosity tendonitis, that can frequently cause pain in the buttock that goes down into the knee area, but it won't go to the foot. All right. And of course, vein problems. AP. I think we're off on orbit by about a degree. We need to fix that when we come back to that lateral view. Vein problems in the calves can definitely cause calf pain. All right, that's better. I'm happier. Folks, while we do this, we have to always be aware of the lung fields and be cognizant of a pneumothorax. We don't want a pneumothorax, but that can happen with the surgery. That's why I have to be very cautious. And the spinal cord, of course, is right here. Sean? All right, so I'm at the facet again. Sean? And I need to navigate around, and I think I just did. There we go. Let's see, I think I'm a little bit below. Thank you, Jordan. Just give me a second. I'm almost there, folks. Shot encountering the facet joint once again, and our orbit is better this time. That's great. Thank you for doing that. There we go, around the facet, and I'm being forced south. There we go, correcting AP. Let's get an AP. Looking good, looking good. We're almost there. We're going to do a discogram next just to verify these are the discs causing his pain. Perfect. You guys see that. It's absolutely perfect needle placement, full lung fields, no pneumothorax. Patient is stable hemodynamically, pulmonary. Everything is perfect. So far, this surgery is being blessed, and I'm very happy that we're making great progress.
Okay, my friend, we're going to ask you some questions. Are you okay? Yeah. He's okay.
All right, my friend. You're what? You're tired? Well, we've been giving you sleepy medicine, but we're going to put you to sleep in just a moment, okay? You're doing great. Everything's going well. All right. Folks, you guys see this X right here? I don't know if you can faintly see it, but when I asked him, where is your pain? He said it was literally here, which is T8, 9, T9, 10, and right up here where we are, literally right there. Okay? So when I put the X, it was a little bit lower than his actual pain, but it's hard for him to reach it up there. Most people have a hard time pointing in that area. You comfy? Yeah. All right. All right, we're going to put you to sleep in just a moment. Are you having any pain? Uh-huh. All right. All right. Nothing lower? No. How bad is that pain right there on a scale of 1 to 10? How high does it go?
We need a number. 5 or 6.
6. Is that where you get your pain? Is that where you get your pain? It's yes or no? Yes. All right, good. That's one of your discs, okay? The highest it went was a 6? Yeah. All right. A little better now? Good. How bad is that on a scale of 1 to 10 right there? What's the highest it goes? Is that where you get your pain? Yeah, so that is where you get it. And is it better now? All right, but that's where you get your pain, in that area. Yeah. Good. So we tested 2 out of the 3 discs, and they're both causing the typical pain that you get, okay? That's good. That means we're in the right spot. Can we get the, oh yeah, it went up with the pain? How bad is that on a scale of 1 to 10 right there?
About 4 or 5.
All right, is that where you get your pain? All right. So that's great news. We're going to put you to sleep. When you wake up, we'll be done. So this was a 5 out of 10, concordant. So basically his numbers of 5, 6, very low, but he also has fentanyl on board, and that fentanyl is going to dampen his pain response. And he doesn't take narcotics normally, so he's very sensitive to the medicine we're giving him, but he's awake enough to give us a reliable indication that we found the source of his pain. It just didn't spike that high like we see with the lower back sometimes. In the lower back, we'll see people getting up to 9, 10 or higher out of 10. All right, we'll start here with, we'll probably start with 9, 10. And Henry, have we shown the audience how we do this disc repair?
Yes, we do.
All right. Yes, cervical. We're going to make a 4mm incision. That's all we need, a Band-Aid incision. It's a stab incision right here along the needle path. I'm going to take the needle out and place a guide wire with a dilator that will slide down the guide wire shot. I do all of this using X-ray guidance. That's what we use for our diagnostic imaging and navigation is X-ray guidance. We use it for localization as well. We use the best X-ray machine available. I'm going to wait a minute, just put some pressure. So the pain from the discogram gave the patient a heart rate increase and a blood pressure increase. We're just going to wait a minute before we continue for his blood pressure to come back down. Yeah, just try to get him back down, even make sure it's heading in the right direction. It looks like it is. So we went up to 120 systolic, which is normal for most people, but we want that blood pressure lower, around 100 systolic for the surgery. That way we minimize the risk of bleeding internally. We've never had a complication from bleeding. We don't want to have one today. And part of our strategy for reducing the risk of complications is controlling blood pressure. All right, any questions while we're waiting?
Yes, we have a question coming from Killer Penguin once more on YouTube, asking, also, could you explain where facet pain would be felt and referred to? Thank you.
Sure. Facet pain is pain that comes from the facet joints. The facet joints are paired joints, right and left, on the side of the spine. They're about 2 finger breadths off the midline. That's where your facet joint pain usually is. And when people have facet joint pain, they'll say, oh, it's off to the right of the midline or left of the midline or both sides. And typically there'll be muscle spasms over the facet joints, and that's a dead giveaway. So there'll be tenderness of the muscles. Facet pain is most common in the lower back, but it also occurs in the cervical very commonly. So we get cervical facet pain, lumbar facet pain, and occasionally we see thoracic facet pain. But again, chronic pain or dorsalgia in the thoracic spine, number one reason, 85–90% of the time, a disc injury, just like this patient has. So we're just waiting for blood pressure to get to where we want it before we go any further, and then we're going to proceed. Have we shown the audience the videos on DLDR?
We have showed them how it is that we cure it, not what causes thoracic back pain.
Sure.
We can show them that.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We're placing our dilator. Our blood pressure is 105 systolic. It's perfect for proceeding with surgery. I'm entering the foramen just now on the left side at T910 shot. And we're about to enter the disc itself. The guide wire is moving forward a little bit. I don't want that. It's perfect right now, but we don't want it going any further. All right, I'm going to enter the tear right now using a mallet to impact the dilator and enter the disc. Can I proceed?
Yes. 105.
Shot? All right, we are entering the tear in the back of the disc. You guys can see the tear. It's that gray stuff. That is the tear.
Yes.
Yeah. Yep. And the dilator is entering that disc right now, right where his pain is coming from. So I feel very confident he's going to get a great result with the surgery. Any other questions?
Yes, we got a question coming from Lanu on YouTube,
Hi, Lanu. Welcome.
asking a gardening question for you.
Sure.
It's winter now, and the gardening season is over. What do you guys do in the winter season?
Lanu, that's a really good question. It turns out my favorite plants are tropical, and specifically my favorite plant are orchids, and specifically cattleyas. Cattleya orchids actually bloom in the wintertime, so this is the time of greatest blooming. So all that hard work of taking care of the orchids all year, this is where it pays off, December, January, February. So all my orchids are starting to bloom right now. I still water them and care for them every day. And right now I have a project I'm working on. One of the biggest problems with orchids are viruses. And viruses of orchids are permanent. They kill the orchids eventually. They affect the immune system. And they make the orchid susceptible to fungus and bacterial infections, which ultimately will kill the orchid. But the viruses, they're incurable. And no one has been able to find a way to get rid of them in the plants. So that's what I'm working on. Trying to find a cure for orchid viruses. If I find the cure, I'll be the first person in the world to discover that cure. All right, you're going to do my wrist or no?
Yes, sir.
All right, folks, we're going to get started. We're going down the tube. You're going to see a nice view inside the disc. I'm sorry? All right. So you're watching that other one? All right. Here we go. I'm going to place the laser fiber a little further. You guys see it there?
Yes, we do.
All right. Now, for those of you who follow Deuk Spine, Henry just released, I mean, his videos are masterpieces, to be honest. He just released a new testimonial from a patient from Kuwait. This patient traveled all the way from Kuwait to have actually many things fixed, including his neck, his back, his hip. And he is so happy with his results. Grab her.
I really like this hat.
Yeah, you like the Deuk Spine hat on him. So please check out. Henry, if you want to put a link to that testimonial here
Of course.
in the dialogue box there. That way people can see it. But that was our first patient who traveled from Kuwait. We're bridging the Arab and American gap here at Deuk Spine by taking good care of our brethren around the world. Look at that herniation there, that blue thing. Now the blue is coming from a dye that we use. We call it the Deuk Spine dye. The Deuk Spine dye is a special dye. It's found in nature. It is sterile when we inject it. Look at that right there. That's a piece of herniation. Now, blue dye that we use only stains to nucleus pulposus. It only stains to degenerating nucleus pulposus. So what does all that mean? Nucleus pulposus is the jelly inside the disc. And when nucleus pulposus is normal, it's white. It's white. And as a matter of fact, if we were to put dye into the disc with normal nucleus, it would be white. The nucleus would be white because normal nucleus pulposus or jelly does not stain blue. Only degenerated nucleus pulposus, which means when you see it that you're looking at a piece of herniation that is degenerated. So herniated nucleus pulposus that's undergoing inflammatory changes from the patient's inflammatory system, trying to remove it and get rid of it, which it is basically a strong indication of inflammation happening in this disc. And that inflammation is the source of this patient's pain. That's what he's been suffering with, is inflammation and inflammation pain. Any questions from our audience?
At this moment, no current questions.
Thanks, Henry. Watch that fiber. All right, we're just going to keep working on this here disc. So basically, we've just popped a quote-unquote zit. If you think about what is inflammation, it is your body's attempt to remove a foreign body from your body. For example, a splinter or a pimple. Your body is attacking what it perceives to be a foreign intruder. That's your defense system. Your body's going into action. So we all know the only way to get rid of a zit is to pop it, right? You have to open it up and drain it. It's an abscess. Abscesses are pockets of pus. Now, when it comes to zits, you have bacteria growing in your hair follicle. That's the foreign body. Your inflammatory system is saying, hey, we got an invader here trying to get in. We need to attack. So your body will literally attack the bacteria in the hair follicle or sweat follicle and cause inflammation. And then you get an abscess, which is a pocket of pus, basically. And you have to drain it. Well, this disc problem is not much different, to be honest. You've got the herniation, which your body sees as foreign. The nucleus pulposus, yes. Many of you are saying, well, why does your body see the nucleus as foreign? It's part of your body. Yes, it is, but your body has never seen it before. I mean, remember, it's in the center of your disc, and your disc has no blood supply. And the inflammatory system can't see things without a blood supply. So when you get the herniation, your nucleus pulposus comes into the annulus for the first time. It's being seen by your inflammatory system. Grabber. Therefore, your inflammatory system is saying, oh my gosh, this thing shouldn't be here. So it starts to attack it. And that's where you get all that inflammation and pain. Any questions?
Yes, we just got a question from Lanu, once more on YouTube, asking, is thoracic herniated disc a common problem? P.S. I saw the testimony on the Kuwait patient. He feels like a teenager.
Yeah, he does. Thoracic herniated discs are not common, and they're not frequently symptomatic, meaning that people may get them, but they don't have symptoms very often. So it's a very uncommon cause of pain. But it does happen. And being able to treat people with this pain is something that Deuk Spine has been doing now for about, I have no irrigation, for about 7 years now. We've been doing thoracic. Before that, we were doing cervical and lumbar. Thoracic is not a common problem, and most doctors won't even touch the thoracic spine except to do shots, because it's such a very dangerous area to work on. All right, let me see. I need to get this back a little bit and maybe advance this forward just a little bit, and that should be good. Any other questions?
At this moment, no current questions.
All right. Well, in that case, let's show the audience why the Deuk laser disc repair surgery is so much better than alternative treatments.
Of course.
Hi, I'm Dr. Deuk Machen. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation, and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Done here. All right, folks, welcome back. Thanks for bearing with us. I have just another few millimeters of annular debridement to do at T8-9, but his surgery is going very well. He's doing very well. He's stable. I know he's here with his parents. He lives in New Jersey, and he came here from New Jersey for the surgery. And right now, if his Parrish is watching. He's doing fantastic. Like, his surgery is going really good. It's going as good as it could go. Bunch of scar tissue right there from chronic inflammation. Definitely the cervical scope was the right choice. We have 2 size scopes, small and big. The big one would be the wrong choice. Thank you, Luis. Just about done here on the first disc. Then we're going to move on to disc number 2. Any questions?
Yes, we have a question coming from Lanu, once more on YouTube,
Lanu, sure.
asking, the patient from Kuwait, he speaks Arabic. Is there some similarity between Arabic and Armenian language?
Oh, that's a good question. I think there is. Armenian is a very different language, completely different. But obviously, where Armenia is in that same area as the Arabs, there's probably some homogeneity in the 2 languages. My father spoke Armenian and he spoke Arabic, but that's because he spent a lot of time in Arab countries living there, like Egypt and Lebanon. He also spoke Lebanese, French, German, English, Spanish. And Turkish. All right. Me, on the other hand, I'm terrible with languages. I am so bad. What is that noise? Guys, any other questions?
Yes, we have a question coming from Hookem 1963 on YouTube.
All right, 1963 Hookem, welcome. Thanks for joining. I think we're done here. That's it. That's some fat right there, epidural fat, right outside the spinal cord. Careful here, careful here. What do we got?
Scope off, please. Thank you.
All right, go ahead.
Asking
Little
how
antibiotics.
recent must MRIs be for your review?
We always tell people like a year and a half, but we'll take up to 2 years. Up to 2 years old. You know, the truth is, if you're operating on somebody, you really want an MRI that's pretty recent, you know? About a year and a half max. So older MRIs aren't really helping you, the patient. But if your symptoms haven't changed much, then it's fine. Do you have a stapler? So we did a 4mm incision. I'm going to staple it closed, and we're going to move on to the next disc. Nice pressure, thank you. Go ahead, Jordan. We'll go for a lateral view. Got water everywhere there. I need a guide wire. Thank you. Any other questions? Don't touch that.
At this moment, no current questions.
All right. Perfect. So, 1 disc down, 2 to go. Another 4mm incision. These are tiny, tiny incisions, folks. Where do you want this, Luis? Okay. Shot. I'm going to take this needle off the guide wire. I'm going to place my dilator, which is literally 2.5 millimeters wide, 2.8. The dilator slides down the guide wire and goes right to the disc. I'm going to enter his disc where the tear is. He has a tear in the back wall called an annular tear, and that's where all the pain is coming from, is that annular tear. That's the same for everybody that has a disc problem. Annular tear. And it was discovered here at Deuk Spine Institute by me that the annular tear is the cause of people's chronic back pain when they have back pain from a disc injury. Okay? So if you have back pain from a disc injury, it's coming from inflammation, within the annular tear. Okay? If you have back pain from a facet joint injury, then your back pain is coming from inflammation within the facet joint capsule, which is just like the annulus. It's a ligament that gets torn outside the joint, and it never heals properly, and you get inflammation. And it's that inflammation in the facet joint capsule that causes facet joint pain. Most doctors try to do a medial branch block and a radiofrequency ablation to treat it, but those treatments don't really work. At Deuk Spine, I pioneered a new treatment that is patented here, and it is a permanent facet joint pain eliminating treatment. We are inside the disc. Take it off. Take the dilator out, and now we have what's called the tubular retractor, which allows me to go through that little tube into his disc and use the laser, which I can control surgically like a scalpel, but even better than a scalpel, because a scalpel has the precision of at most 1 millimeter, whereas a laser has 20 times more precision when it's used properly with a high resolution endoscope like we do. I can peel away 1/20th of a millimeter of abnormal tissue with the laser. Scalpel, you can't even see past the blade to see what you're doing. That's why a scalpel doesn't work with this type of surgery. There's no other tool that works. The laser is the tool. Must use it. There's no gimmicks here with our laser. We use the laser. It's very precise. And just to give you a reference, that glass laser fiber you're looking at right there in front of you at 12 o'clock, how big do you think that is? How wide is it? The answer, it's 0.5 millimeter. Less than 0.5 millimeter. It's 0.45 millimeters. So it's very, very, very skinny. As a matter of fact, if you take your fingers and spread them apart, you can see about 1 millimeter. That's how small you can bring your fingers to see light. So most people are familiar with just enough distance between their fingertips to see light, and that's 1 millimeter. This is half of that distance. But you see it's so big because, well, that's what the camera, the lens system does. It magnifies the image so much that it looks big, but it's not. But that helps with the precision of the surgery. That makes this surgery very precise, far more precise than open surgery. What other surgeons are doing, discectomy, fusion, laminectomy, that's like 100 times bigger scale than what we're doing here. And when you're operating around the spinal cord and the nerves, you want to be precise. You don't want to be on a big scale. You want to be on a fine microscopic scale, basically, which is virtually where we are. We call it endoscopic because we're using an endoscope. All right, this is the second disc. This is T8-9, and we're removing pieces of herniation quite nicely. You can see none of this is normal. This is all full of inflammation and scar tissue. You're even getting some calcification called dystrophic calcification inside the disc, inside the annulus, from all the inflammation that's been going on for years. Now I can tell you this injury to me is at least probably 8 years old or older, maybe around 10. Could be older than 10. But what's that? Yeah, he recalls no trauma, he said. But it may have happened when he was playing high school, sports. Something may have happened to him. We don't know. The patient does not recall the trauma that happened to his spine, but many patients are like that. But the reality is there was trauma, okay? The only way you get a disc injury like this is trauma. So it could have been a car accident. And unfortunately, the truth is a lot of insurance companies, like car insurance companies, will lie to you and tell you there's nothing wrong with your spine. They'll send you to their doctors that they know will tell you that there's nothing wrong with your spine and that you don't need treatment, even though you're having horrible pain. So don't trust the insurance companies, because they are not either knowledgeable or they're not working in your best interest. This surgery is not cheap. This is an expensive surgery. The insurance companies don't want to pay for it. They want you to suffer with pain, because you suffering with pain, drinking Jack Daniels or doing marijuana doesn't cost the insurance company any money. See, it's free for them when you do drugs and alcohol to treat your pain. And that's what they want, because they're not paying for your drugs and alcohol. They only pay for surgery. So as long as you don't have surgery, they're making more money. And that's a problem in our country, a problem that needs a solution. I hope to God that President Trump and his administration will fix this healthcare problem, because it is a problem. As a country where the unhealthiest developed country, like ranking in the 60s out of 100, you know, we used to be number one 30 years ago. We were the healthiest nation in the world. And now we're so unhealthy. And it's not because of McDonald's, folks. It really isn't. Our soldiers used to eat Spam back in World War II. Spam and smoked cigarettes. And they were healthier than us. It's not about diet. It's not about smoking. It's about the fact we can't get the medical care we need, because our insurance companies have taken control of medicine and are now just denying any treatment that works because it's expensive for them. They don't want to pay for it. All right, any questions? Because I'm
Yes.
almost done with this disc, and then we got one more to go.
Yes, we have two questions. This will go with the very long one, and/or seeking advice from Roger on YouTube,
Hi, Roger.
saying my wife has had a small disc bulge at T8 and T9 that causes her great pain. All her treatments to this point have failed, including deflating her lung and freezing the
Jesus.
nerve.
Oh my God.
She is having a permanent spine stimulator implanted next month.
Don't do it.
As the 1 week trial
Don't
seemed
do
to help.
it.
All the surgeons she has seen refuse to operate, as it would be a blind procedure involving removal of a rib and a very high risk of paralysis. The
That's right.
recent MRI showed no change, and the small portion pressing on her spine appears to be calcifying. Can this be repaired by using your technique?
Absolutely, 100% it can be repaired by this technique, yes. Please don't do the stimulator. I'm going to tell you what they do for those stimulators. It is a trick. They put the temporary in, and while they're doing it, they give you some steroids. The steroids are going to make everybody feel better. So everybody gets better for a little while. Then they go put the permanent in, and guess what? You don't get any better. And the reason why? Because they tricked you into putting the permanent one in. So why would doctors want to put a stimulator in? Because it is the highest profit procedure anybody can do today in spine surgery. I mean, if I cared only about profits and not about my patients, I would be putting in 100 stimulators a month. We have that many people. I could recommend it to everybody. I would be a multimillionaire just from these stimulators. But we don't do stimulators because we know they don't work. Do not do it. It is a scam. One of the biggest scams in medicine today. Stimulators. They're promoted by companies like Boston Scientific because they make a gazillion dollars. They literally, Boston Scientific makes $20,000 to $30,000 for each stimulator they sell. Okay? Now, it probably costs them, I'm not joking here, that's my opinion, so don't go sue me over this, but they probably pay $500 for the stimulator, okay, at most. And they're making 20 to 30,000. Who doesn't want a profit margin like that? Okay? No, everybody wants that kind of profit, but it's a scam. It's a ripoff. They're ripping off our healthcare system, and they're ripping patients off, and they're putting people at risk of complications, serious complications. Okay? No joke. I highly recommend you avoid that stimulator and let me at least look at her MRI and do a telemedicine consult with her. We do a free virtual consultation, no charge to you guys, over Zoom. You just got to fill out our form, tell us where your pain is, send us your MRI, and I will personally meet with you guys at free of charge to spend about 15 minutes of my time talking to you and figuring out what's wrong. And if this surgery will work for you, I would do this surgery. It's permanent. It works every single time. Our average pain relief for this surgery is 99%. That's when we ask our patients a year after surgery, that pain you had, remember in the thoracic, do you still have it? No. How much of it is gone? 100, 100, 100, 100, 100, 95, 100, 100, 100. So basically the average is 99%. Okay, it works. People never come back and they don't get any other treatments done. So this is the way to go. If it's discogenic pain and I can evaluate your wife, but please don't do the stimulator. Any other questions, comments?
Yes, we do have a question from Hookem 1963 once more on YouTube, asking if I have both lumbar and cervical issues, which would you suggest be repaired first?
Oh, that's a great question, Hookem. The answer is really comes down to which is the most serious. So cervical, if you're, let's say you have a herniated disc in your neck and it's pinching on your spinal cord causing you to go paralyzed. And in your lower back, you've got just back pain and a pinched nerve. Well, a pinched spinal cord is serious. So if you have a pinched spinal cord in your neck, we call it myelopathy, you've got to get the neck fixed first. But if it's just neck pain, no pinched spinal cord, then you can just choose if you want your back or neck fixed first. The only time, that the neck has to be done first is when there's a risk of being paralyzed if you don't treat it. That's when I would recommend getting your neck done first. All right, we are so you guys see this? We're at the outside of the tear right now.
Yes,
Look
we
how
do.
nice we cleaned it out. It's literally totally cleaned out. I've gotten rid of all this herniation here. This is like a little vein of gold, but instead of gold, it's a herniation, something you don't want. Everybody wants gold, but nobody wants a herniation. And there's a little bit of bone spurs right there. That's why they're turning golden color. That's what bone does, calcium does. When it hits the laser energy, it turns gold. You see a lot of that right here because there's been a lot of inflammation here. And the more inflammation you have for the longer period of time, the more bone spurs you get. All right, so we call that degenerative disc disease, and it's really just due to inflammation. Unfortunately, most doctors have no clue what causes degenerative disc disease. We know what causes it at Deuk Spine. It's inflammation. So get your Deuk laser disc repair done, get rid of your inflammation, get rid of your pain, and have a normal life without worrying about pain coming back. All right. Well, we're looking out to in. There it is. I don't see any more. Maybe a little bit right there. A little overexposed, but that's fine. And going to get this last bit, and we're done. And we got to go up to the last disc, T3-4. Great questions, great dialogue, great viewership. Thanks, everybody. Thanks for the support. We need your support here at Deuk Spine. We're trying to help you guys get out of pain, and you and your families and friends. That's what we do. All right. Any other questions, Hen?
At this moment, no current questions.
All right, good. Guys, we're done here. I'm going to do some antibiotics and bring the tube out, but that's it for this level. We got one more disc to go up higher. And this is the hardest laser surgery I do, the most challenging for the surgeon. It's not hard for the patients usually. It's pretty easy, like they don't complain about pain or anything. Actually, people don't really complain about pain at all. The next day, everybody's pain is gone. But this is technically the hardest surgery that I do with the laser. Cervical is easy, lumbar is easy. I mean, C7T1 is super hard, but thank God it's rare. This thoracic is definitely the hardest of all the laser surgeries that I do. So I don't like doing it, but I do it because it helps people get better. It gives them their life back. And that's, after all, why I went into medicine, is to help people with their conditions to improve their quality of life. And this surgery definitely does that. No doubt about it. Been doing laser surgery for 20 years, folks. 20 years. Started in 2006 here at Deuk Spine Institute. Here we are in 2026, 20 years later. 2,735. This is number 2,735, right, Henry?
Yes, sir.
That's how many endoscopic laser surgeries we've done. 2,735. And our next patient today will be a piriformis SI. So he's not having laser surgery, he's having his piriformis and SI done. And he's an old patient of mine. We did his discs long ago. Shot? Yeah, we did laser on him, right? Back in 22. And his disc pain is gone. He's so happy. But he now has piriformis and SI, which is below the disc. And I got it. And he wants me to fix those. So we'll be doing a bilateral SI and a left peri. Go ahead, Luis. Thank you, Luis. What would I do without Luis? I'm not going to find out. I love my team, honestly. Got the best people in the world working here now. Had some bumps over the years, but I am a very demanding boss. Let's face it. I mean, after all, I'm doing spine surgery, right? So I don't want anything to go wrong. If something goes wrong, I don't pay for it, my patients do. So to me, it's very important that we do things right. And for things to be done right, I need everybody on board doing everything right. That's the magic right there. So I demand my team to be very high performance, focused, and dedicated to the patient's well-being. And that makes me a tough boss sometimes. You know, once in a while we do get a goof off. They don't last very long. Right, Luis? All right, blood pressure is still good. Here we go. All right, so Jordan, there is the back of the disc. I'm seeing right now, I think we're right at the back of the disc. It feels like it. I'm entering the tear. I can feel it. Take that. Wait. Let me just see. Shot. Yeah, you got it. Yep. All right. We're in. Whew, thank God. Let me see. Hold on. Let me just look at this. All right, folks, we're in. Let me just look at it for a second. All right, good. We're in. We're in and we're in good position, which is what you want to see on that x-ray. Yeah, so this is the most sensitive disc, Dr. Berndes is telling me, and he's right. This is the one the patient pointed out that was his biggest problem. And what we're seeing when we're manipulating the annular tear right now is his blood pressure has gone up as a result of his pain. So we're going to give him some more medicine to help control that. But we can see as we're doing these disc surgeries, when these discs are the source of the pain, we can see the patient's hemodynamic status change. We see their blood pressure go up. We see their heart rate go up. And this patient is no exception. So I feel good about it. I feel like we're going to help him a lot. He came here to get rid of his pain. His pain is never going to go away on its own. When you have discogenic pain, it doesn't go away on its own. It must be operated on. And this surgery is the best in the world. There's nothing better. It is the safest. It's the least invasive. We lost maybe 2 cc's of blood the whole surgery. You guys see all the incisions?
Yes, we do.
We literally lost almost no blood. There's no hospitalization. It is the most effective treatment for discogenic pain in the world because we have a 99% of the pain cured. So you can't beat that, folks. You can't beat the results. It's got the best results with pain relief. It's got the safest profile because we've not had a complication in 20 years of doing this surgery. There is no other surgery in the world on the thoracic spine that comes close. All right, here we go. So the laser fiber, once again, for those of you who came in late, that is the glass thing you're seeing there at 12 o'clock. I'm coming out of the tube to get rid of the herniations. The only way to get rid of these pieces of herniation is to literally lift my scope out of the tube and then go back in. That's how we get rid of these herniations. Like that piece right there, I have to float it out. Any questions?
At this moment, no current questions.
All right. I got 10 minutes, Dr. Berndes, 10 minutes. Remember, our patient is under sedation. He is not under general anesthesia. There is no tube down his throat. This is twilight. Same thing you get when you have a colonoscopy, except minus the colonoscopy.
This is the safest anesthetic for this procedure.
Yep.
Because you don't want to mechanically ventilate this type of patient.
Dr. Berndes says this is the safest anesthesia for this type of surgery available in the world. We have it down pat. We have a way of doing it here at Deuk Spine Institute that is second to none. It is the safest for the patient. I've developed some special techniques that Dr. Berndes uses to help with the anesthetic and the patient's respiratory system to stabilize it, right? Our CPAP machines. Deuk Spine Institute has the very best anesthetic equipment available in the world. We have all the toys like glide scopes and fiber optics, and we have all the best monitors, the best drugs, the best equipment, the best staff.
We didn't have that, I wouldn't be working here.
Yeah, we literally have look at that inflammatory tissue right there. See the red? I just zapped it away.
Yes, we do.
That's your tear right there, folks. That's your tear. Beautiful. Absolutely beautiful. I'm so happy for this patient. I'm happy he found us. He will say God led him here, and I believe that. I 100% believe that. Folks, I'll be honest with you, we shouldn't even be here. I mean, I don't know how much you guys know about medical economics, but surgery centers, they require 10 surgeons or more to survive. We've survived for 12 years now with 2 surgeons. 2. And soon to be 1. But we will still survive. And that's because I truly believe it's God's will. That's my opinion. God wants us here to serve our patients. And that's why we're here. We shouldn't be able to do what we do, but we do it. It's really, honestly, it's something very special. There's not a day that goes by in my life these days that I don't think about how lucky I am to be able to help people like this get out of pain. And I know my whole team feels the same way. Everyone except for, I'm just kidding, all of us. We all love what we do. People aren't here because I pay them so much money. They're here because they love this job. I actually wish I could pay them more, but I can't. I can't afford it. They're here because they love the job. They love working here. They could all leave and go make a lot more money. I'm sure they could, but they don't. They don't because they feel they have a purpose here, just like I do. I mean, I could retire. I could go on and go to the Caribbean, and I love going to Mexico and South America, Puerto Rico. I mean, I love scuba diving and beaches, but I don't go. I stay here because my patients are here and they need us. That's why I come to work every day. That's why I have my team around me, because we all feel the same way. Any other questions?
At this moment, no current questions.
All right, I got news. We are 2 minutes away from being done. And this will be the 3rd disc on this patient, is top 1. And I got to say, it's gone better than I expected. I'm so thankful that it's gone so well. And again, it just comes down to having the right people, the right equipment, the right experience. That's what makes a surgery like this happen and finish well. I think he's going to be very happy with his results. I really, really do. I've never had a failure with this technique when somebody's pain is coming from their disc. It's worked every single time. We don't have failures with our DLDR because we select the patients properly and we do surgery on the right discs. Okay, a lot of doctors don't know where pain comes from, so they guess. where to operate. They guess which disc to fuse, which disc to do an arthroplasty. They just guess, and they're wrong most of the time. The magic at Deuk Spine Institute comes in two ways. One, the diagnosis, and two, the treatment. Everybody thinks it's the treatment. It's not just the treatment. It's how we apply the treatment to the right areas that are pain generators, that cause the pain. I have to thank Dr. Anthony Young, one of my mentors, Tony Young. He had a profound influence on my endoscopic career. It's because of him that I am doing endoscopic surgery. He is the reason. And he opened the door for me many, many years ago. 21 years ago, he opened the door for me, a doctor he didn't know, just a guy from Florida, came to Phoenix, actually went overseas with him and learned endoscopic surgery from the top endoscopic surgeons in the world at the time, 20 years ago. Dr. Sang Ho Lee, Dr. Gun Choi, Dr. Sebastian Royden, Dr. Anthony Young, Dr. Knight from England. Those were the top. They were the best. They are the forefathers, our founders of endoscopic spine surgery. And they allowed me to train with them. They taught me everything they knew. And they didn't just teach me, they taught other surgeons too. There was a handful, maybe 10. And we have now taken what we've learned from them and we apply it to our patients, and our patients are rewarded because of our commitment to furthering the education and understanding of medicine and how it should be applied to the human body to cure disease. And that's what we're doing. So thank you for joining us today. And I am just about done. The last few zaps with the laser. Any other questions?
At this moment, no current questions.
All right. Well, thanks for joining us. Once again, we are now at the outside of the annulus. You can see I've cleaned it out, got rid of the herniation that was there that was causing all that pain. A little bit of scar tissue right here and a little calcification. But for the most part, that's it. We are 95% done. Got about 30 seconds left and then we're finished. How's our patient, Dr. Berndes? All right, next case, like I said, will be a piriformis and SI joints treatment. So come back in about 30 minutes for that. 40 minutes, 30, 40 minutes, and join us. Happy New Year to everyone. And I hope we have an opportunity to help some of you out there and your families and friends get better. I think 2026, I'm being told, is going to be a great year for Deuk Spine. Right, Nikki?
Yes.
All right, 10 seconds, and I'm done. Last chance for questions, and then I'm going to turn it over to Henry and one of our patients. Maybe he'll show you our one of our patients who had the thoracic DLDR and how well they did.
Indeed, I will.
This one here is from Jersey. Our last one was from South Africa, right? Yeah. Was he South Africa? Wasn't the South African? Yeah. Yeah, right before the new year. Right before the end of the year. Do we have a... For thoracic? No, thoracic laser was a South African surgeon, remember? Yeah, he was the last one, and now our pastor here from Jersey. All right, well, this is it right here, the last blue glob, and that should be it. Just want to get a little bit more, and that's done. Huh? Yeah, the guy from South Africa. I think he did very well. All right. Wow. The never-ending herniation, right? But this should be it right here. This looks really good. All right. Well, Henry, we are just about done. Probably 5 seconds, and we'll be done. I'm surprised. This one is worse than I thought. I mean, it looks like the herniation is pretty bad here. It's no wonder why it's caused so much problem for this patient. Any other questions?
At this moment, no current questions.
All right. How's the blood pressure? Is he responding? Because this is the most painful part of the surgery right here. I'm just wondering. Does he seem to be responding at all, or is he good? Good and stable? All right. I'm going to flip this one more time. There we go. Looking laterally there at the lateral part of that tear. There it is. Yeah, it was the most sensitive one. Done. Done, done, done. All right, done. Great job, team. Oh, wow, we got a full bag here.
I'm gonna put this sucker over there.
All right, so just little antibiotics. Any last minute questions?
No current questions.
All right. Scope use is a 9. I'm going to come out and show you guys this incision. Take a look at this. How's our canister? Because we got a huge amount here we want to suck up. You guys see the incision here?
Yes, we do.
2 on, please.
It's about a 5 millimeter incision.
Thank you.
There you go. Let's put pressure. All right, this looks good. Everything is looking good. And Henry, we can go ahead and go over to our testimonial. Thanks for joining us. We'll be back in 30 minutes or so. Hey, good morning. March 6, 2024. I'm Dr. Deuk Majan. I'm here at Deuk Spine Institute with one of my patients who traveled here for a thoracic disc problem. I'm going to let her tell you a little bit more about how life was before her surgery. Thoracic disc herniations and pain, they're not as common as lumbar and cervical, but when they do happen, they can rob people of their quality of life. What was your life like before you had your surgery yesterday?
Oh, miserable. I spent over 5 years being in 24-hour pain. Just pain. Couldn't go anywhere. 95% of my time is at home, in the house. Before then, I would dance, have fun, work out. But now, pretty much, I'm a prisoner in my own house, in my own body.
And where was your pain?
Right at T3, T4, burning, aching, 24 hours a day, no sleep, nothing. Just sitting in the house all day, not living my life at all.
And yesterday we went in endoscopically. We found that T3-4. We used the laser to clean out your disc and get rid of the herniation and the tear. How do you feel today?
Oh, I feel fantastic. I feel like a new person. I feel like I got a new beginning, a new chance at life. Thank God for you.
You know, the burning, it's common for people to have muscle pain after the surgery. We can't fix muscle pain. We fix joint pain, but we can't fix muscle. And unfortunately, when you have joint pain like you did, the disc pain, it's a deep knife aching pain, and it keeps you from doing things like you said. You were robbed of dancing and doing all the activities you normally do. So the muscles get deconditioned. They start to get weak. It takes time to rebuild them. And that's one of the things we can't do as surgeons. We can't rebuild your muscles. The patients have to. And so now you're going to go out and be active.
Absolutely.
You're going to start dancing again.
Absolutely.
And who are you going to think about when you're dancing?
You?
Dr. Deuk and Deuk Spine.
I'm gonna make up a Deuk line dance. How about that?
Oh, I love it. Promise me you're going to post that on YouTube so we can see it.
I have a YouTube channel. How about you? Gotta come on my YouTube channel.
I would be happy to come on your YouTube channel.
Sure.
You have my cell phone number. Text me. Let me know what you want me to do. I would
Okay.
love to
Okay.
do whatever you need me to do on your
Absolutely.
YouTube channel. It would
Absolutely.
be an honor.
And I want to say one other thing.
Yes, ma'am.
If you're in pain, don't ever give up. I research countless
Amen.
nights. Don't believe what the first doctor say. I had doctors who tell me just be this way the rest of your life. I refuse to give up.
Mm-mm.
I said, no, you just practicing medicine. I'm moving to somebody else. So don't give up. Don't believe the first doctor, the second, third, fourth, or fifth. I've seen over 20 doctors to be exact. So don't give up, do your research, and come to this man, Deuk Spine Institute in Melbourne, Florida. Don't give up.
We've been very blessed here at Deuk Spine for several reasons. God has given us the ability to understand where pain comes from, but also how to get rid of it
Absolutely.
properly and safely.
Absolutely.
And that's what we did yesterday. We went in with the endoscope and we found the tear and we used the laser. We did it all with a 4mm incision. You can almost not see it on her back. I had to look for it.
Right.
But it was right next to that giant incision that
Yes.
they did. Some doctor tried to cut her muscle out of her spine
Yeah,
to
he
get
did
rid
a
of her
trigger
pain.
point excision is what they call it. Yeah.
That was a first for me in 26 years of practicing spine surgery. I've never seen that. Cut the muscle out. But that's not the right thing, folks. Muscles are not the main source of pain. It is the joints, and the muscles are secondary. So fix the joint problem underneath, and the muscle pain will eventually go away. Congratulations. Is there anything else you want to say to your people out there, your YouTubers, your followers?
Absolutely. Just stay tuned. The party is going to happen. The party is going to happen. And one other thing, you said this was the first time you ever seen this. You're the first doctor I ever seen what you do.
Thank you.
So we're 1 and 1.
There we go.
Hey. Thank you so much, Dr.
You're
Deuk.
welcome. Safe travels,
Thank
sweetheart.
you.